Good morning or afternoon, as it may be in your time zone. Thank you for joining the Second Chance Act Innovations in Reentry Initiative Grant Program Orientation webinar. The purpose of this webinar is to share information about this grant program, including submission of the Planning and Implementation, or P&I Guide, and its related timelines. We will also discuss resources that are available to support your grants and answer questions about expectations for the planning and implementation process. My name is Mary Heidel-Haight. I'm the Corrections Project Manager at the Council of State Governments Justice Center, and will be presenting today along with Deanna Hoskins, Senior Policy Advisor at the Bureau of Justice Assistance, U.S. Department of Justice. I'm excited to share that we're also joined by Dr. Vino Baker, Grant Writer, Fulton County, Georgia Sheriff's Office, a fiscal year 16 Innovations in Reentry Initiative grantee. Thanks to all of you for joining the webinar, and to BJA and Dr. Baker for partnering with us on this presentation. Before getting started, I'd like to briefly talk through a couple of housekeeping items about how the webinar is going to work. Anytime during the webinar, you could ask a question by typing it into the Q&A panel on the bottom right-hand portion of your screen. This includes both technical and content-related questions. We will try to reply to the technical questions in the chat window as we go. For the content-related questions, we will be keeping a running list and address them all at the end of the webinar. We will do our best to get through as many questions as possible. If you encounter technical or audio problems during this webinar, please call WebEx Technical Support at 1-866-229-3239. Please understand that there are some technical issues you may not be able to resolve. For this reason, we are recording the content portion of this webinar and will post it on our website at csgjusticecenter.org/NRRC. We should have the webinar posted online early next week. Once it has been posted, we will email you a link to the recording. Today's webinar is organized into 5 parts. Deanna Hoskins of BJA will walk us through some of BJA's expectations for grantees and some key program requirements. We'll talk about NRRC technical assistance to support your work and an overview of the Planning and Implementation Guide. Then we'll hear from Dr. Vino Baker about Fulton County, Georgia's experience with their reentry initiative and how technical assistance and the P&I Guide facilitated that process. Finally, we'll wrap up with a question and answer period. I'll now turn the presentation over to Deanna.
Thank you, Mary. Hello. During your grant process, you will be connecting with BJA staff with the items pertaining to finance, progress reports, and grant adjustment notice. A quick note about grant adjustment notice, referred to as GANs. A GAN is used to request project changes and/or a correction for any programmatic, administrative, or financial change associated with your grant award. All GANs must be requested electronically by the grant recipient through the GAN module in the Grants Management System known as GMS. However, prior to submitting a GAN, you should have an in-depth conversation with your TA provider and BJA policy advisor as to your particular need for a GAN. Booz Allen Hamilton, Inc. oversees the PMT data collection. You will be reporting on a quarterly basis utilizing this tool. An instructional webinar will be held to introduce you to the reporting schedule and information collected. Training and technical assistance will be provided through the National Reentry Resource Center. The Second Chance Act has supported over $300 million in reentry investments to a variety of initiatives across the country. The Bureau of Justice Assistance administers these grants, including the Innovations in Reentry Initiative. We'll now move on to provide an overview of the SCA Innovations in Reentry Initiative Grant Program. As stated, here are the goals of the program, and they are to support jurisdictions to develop and implement comprehensive and collaborative strategies that address the challenges posed by reentry to increase public safety and reduce recidivism for individuals reentering communities from incarceration who are at medium to high risk of recidivating. Within the context of the initiative, reentry is not envisioned to be a specific program, but rather a process that begins when the individual is first incarcerated at pre-release and ends with his or her successful community reintegration and reduction in risk of recidivism post-release. So again, congratulations on your award. BJA selected your proposals out of applications from across the country. We have a wonderful assortment of initiatives that will be undertaken by your cohort. This includes Alaska Native Justice Center. They're going to do the NOVA Smart Reentry Services Project, which will serve 320 medium and high-risk Alaskan Native young adults released from correctional custody to Anchorage. Multnomah, Oregon, the Women's Reentry Assessment Programming and Services will create a gender-specific continuum of care for at least 75 women released from jail to the supervision of the county's Department of Community Justice. County of Alameda, California, their project is called My Hometown Expanded, will serve 18 to 24-year-olds at Santa Rita County Jail, including clinical case management, impact coaches, enhancing their pilot project, the American Job Center, inside the jail. Spokane, Washington will be developing a Spokane Regional Reentry Network, which will be a single point of entry for reentrants with 20 pathways of services. Lancaster, Nebraska will be using a matrix model behavioral health specialist for their supervised sentence conversion reentry program, which will serve 18 to 25-year-olds with behavioral health issues. Louisiana Department of Public Safety will roll out reentry to 10 new areas and deploy a new regional reentry center and day reporting center. Michigan DOC is targeting those who are 24 and younger and will utilize a data system to help cross-system resource coordination, offer pathways to career job opportunities, and provide social work services to those participants as well. The Executive Office of the Governor of Delaware will implement the Delaware Smart Reentry Change Team, which, they will integrate R&R reentry tools and the IDAPT reentry process into standard DOC practice to create a seamless reentry process. Texas Department of Criminal Justice will be addressing co-occurring substance abuse and mental disorders for medium to high-risk special need offenders in a therapeutic community substance abuse felony punishment facility program. They will add specialists at 4 facilities and at transition. And then we have Palm Beach County, Florida, the Regional and State Transitional Offender Reentry Program known as RESTORE will implement transitional employment programs delivered in tandem with evidence-based practice. You join a large group of agencies and organizations throughout the country dedicated to improving the pre- and post-release services in their communities. Through FY16, there were 96 awards and over $50 million in funding. These are important components that have led to previous success. The Reentry Task Force provides a key opportunity for policymakers to work together to identify and address barriers to effective reentry, including barriers that are policy or procedural in nature. Collaboration with your research partner is critical. I'll say that again. Collaboration with your research partner is critical, and we will discuss this more on the next slide. Connection to those agencies that attend to health, mental health, housing, homeless services, child welfare, education, substance abuse, victim services, state child support, and employment services will provide the wraparound services needed for the reentrant to be successful. Finally, your TA provider can guide you through the planning and implementation process and is a valuable resource to you. Do not underestimate the value of your TA provider. Practitioner agencies are required to partner with research using an action research approach to enhance the collection and review of data, which in turn can serve as a strong foundation for outcome evaluations of program interventions. Successful partnerships between practitioners and researchers requires investment of planning, time, communication, complementary skills, and adequate resources. Grantees are required to participate in technical assistance from the NRRC. I'll say that again. Grantees are required to participate in the technical assistance from the National Reentry Resource Center. TA providers meet monthly with BJA, summarizing updates on your progress and achievements. Your TA provider offers assistance in completion of your P&I guide, identifying measures to track progress, providing resources to support your initiative, connection to peers, and the ability to highlight the successes with others in the field. Maintaining communication and connection with your TA provider is key to a successful grant experience. I'll now turn the mic back over to Mary to describe this process further.
Thanks, Deanna. The Council of State Governments Justice Center is also a grantee of BJA and the provider of technical assistance for your grant. With the Justice Center, the National Reentry Resource Center, or the NRRC, is funded by the Bureau of Justice Assistance, and we provide the support to Second Chance Act grantees and the broader field. The Second Chance Act, or SCA, which was signed into law in 2008, is the first federal legislation to authorize federal support for reentry programs. Recognizing how complex reentry initiatives are and the importance of integrating research and evidence into those initiatives, SCA authorized the creation of a National Resource Center for Adult and Juvenile Reentry. In 2009, following a competitive process, the CSG Justice Center was selected to launch the NRRC and provide training and technical assistance to all other SCA grantees. We administer the NRRC in close partnership with BJA. On behalf of the staff and board of the CSG Justice Center, I again congratulate you on your selection as an SCA grantee. They are highly competitive and sought after, and the policymakers at federal, state, and local level are looking to SCA grantees to advance our understanding of effective reentry and recidivism reduction programs and practices. We are wholeheartedly committed to providing support that will help you make the most of your grants, and we look forward to working with each of you as you implement your projects. The NRRC website is a great resource for grantees and the field at large. You will find a directory of our latest projects, resources, facts and trends, and items in the news. Each topic page provides links to recent research and publications and news clips about that subject. The NRRC regularly hosts webinars on a variety of topics related to reentry, and all webinars are recorded, archived, and available on our website. You can find these distance learning tools under Resources. Also under Resources, you can find publications. The NRRC is building a large online library of publications related to reentry, and to date there's over 1,200 items in the library. Through the search box on the site, you can access our publications as well as any other publications in the library. The Justice Center is also home to several projects such as the Reentry and Employment Project and What Works in the Reentry Clearinghouse. The Employment Project is rooted in working with business leaders, policymakers, and practitioners around the country working in corrections and workforce to collaborate with the goal of improving reentry and employment outcomes for individuals with criminal histories. The Clearinghouse is a one-stop shop for research on the effectiveness of a wide variety of reentry programs and practices developed in partnership with the Urban Institute. We're constantly adding new resources, webinars, funding opportunities, and other news to our website, and we send out a monthly newsletter that will connect you to those new resources. We encourage each of you to sign up for our newsletter, which you can do on our website. I'd like to introduce you to our team of TA providers that will be assisting you during your grant process. Bonnie Sultan, Blaine Stum, Erica Nelson, and myself are here to support your grant initiative. Our goal as the TA provider is to help you meet the requirements of the grant. This is done in a variety of ways, by providing education and learning opportunities for staff, sharing lessons learned across jurisdictions, facilitating conversations with federal partners, policy and procedure reviews and rewrites, translating research for practice through general program guidance, assistance on reporting outcomes to stakeholders, supporting public education efforts. Every grantee will have a standing monthly call with their TA provider, and at times you'll be in more frequent communication. We're always available by phone or email. There may be commonalities across your projects and with past grantees' projects. Those commonalities will include various trouble spots, and we can bring forth lessons learned and share resources. The Planning and Implementation Guide, referred to as the P&I Guide, enables grantees to identify the degree to which practices are in place to advance reentry and reduce recidivism in their jurisdiction. The guide is not intended to be a step-by-step blueprint, but rather to foster discussions on best practices, identify considerations for your collaborative effort, and help you work through key decisions and implementation considerations. You will work with your team of stakeholders and your TA provider to complete the guide in phases. Your TA provider will ask for completed sections in advance of scheduled TA calls in order to further discuss the exercises on the calls. Well, you've heard about it in the solicitation. Now it comes to life. There are 6 sections of the P&I guide. We'll touch on each of them briefly. Your TA provider will explain each activity more thoroughly on your calls and answer any questions unique to your situation. In Section 1, it's identifying goals and assessing initial technical assistance needs. There may have been some updates or developments since your original application was submitted many, many months ago. This exercise is intended to give your TA provider a sense of your current project goals and your initial technical assistance needs. Convene team members, including key stakeholders and partners, to confirm your goals and target population and to identify any revisions to your project plan since the proposal was submitted. After this webinar, we would like you to forward to your TA provider the following items you should already have available: a copy of your signed BJA award document with any grantee-specific conditions, any MOUs, interagency agreements, and information sharing agreements you have worked together to develop, a program flow chart, a gap needs or capacity analysis, and you'll find a list of all of these items on page 3 of the P&I guide. One of the activities in this section is completion of a logic model. Some of you may have already completed a similar activity with your team as you were preparing for the proposal you submitted. A logic model demonstrates the causal relationships between goals, activities, and results. It's a useful tool to visualize the purpose and scope of proposed activities, including the resources needed and expected outcomes. For example, as you decide upon the larger goals of your initiative, have you thought about what resources will be needed to complete the activities and accomplish the objectives and goals? How long will each activity take to complete? Who will be responsible and what will be measured? These are great discussions to have with your evaluation and research partner. Developing a well-thought-out logic model will help ensure achievement of your goals. The sample provided here walks through 2 goals. The first one is to implement risk and needs assessment. The resources needed to do this will include grant funding and additional training funds for the correctional staff. And then they show by March 2018, they will integrate the tool for use during the intake process and during reentry case planning. The process measures for this goal would be the number of assessments completed. The short-term outcome will be the administration of this assessment for all participants upon intake, and the long-term outcomes will be that all case plans will be developed based on the results of the assessment. In a few minutes, Dr. Baker will describe further how this activity helped focus their project. The fact that you're here today represents the forward thinking of your leadership to respond to the solicitation looking for innovations or improvements to your current reentry strategies. Establishing this task force, leadership structure, and project roles is essential for improving outcomes. Effective planning and implementation requires coordination across multiple agencies, state and local jurisdictions, and justice systems, and service providers. The task force can help unite all system stakeholders around what works to improve reentry and increase public safety while promoting coordination across systems for data sharing, assessments, case planning, and service delivery. Finally, the task force ensures that agency leaders work together to advance and support jurisdiction-wide policy and practice changes. In this section, you will take an inventory of those partners and their roles in this initiative. Are all the necessary players at the table to ensure that the project will be successful? As mentioned, each of your projects is unique, and your answers in this section regarding target population correspond accordingly. For example, some of you have focused the target population on transitional age youth, some on those with behavioral health needs, some are gender specific, some are returning from state correctional facilities, others from local jails. As you know, the risk principle states that the greatest reductions in recidivism will be achieved by focusing programming and resources on people who are assessed as having a higher risk of recidivism. Validated screening and assessment tools are utilized to identify the target population. This section allows you to describe in detail the initiative's target population, ask you to identify what risk and needs assessment tool will be used, as well as other behavioral health screenings and assessments used, and how the screening and assessment process will look through the development of a flow chart. Section 4 covers the evidence-based programs that will be provided to participants before and after release, along with the other supportive services that will assist participants in reentry. The discussions generated through these activities help assess what resources are available to address the needs of your target population. There are also exercises to define the process of connecting individuals to health care coverage, as well as an assessment of housing partnerships. We have some basic guidelines for developing and implementing quality programs. The first step is to conduct research to fully understand the needs of the target population and whether there are available resources to address those needs. The second, are there sufficient programs and program slots in each domain area to address the needs? For example, if the ideal group size is 10 for your behavioral health intervention and you have 80 potential participants, only a small fraction of those in need will be able to participate. Review the content of these programs to assess fidelity to evidence-based practices and any aspect of the program that can impact outcomes, such as the staff skills and community linkages. Then address any of those deficiencies by providing training to those facilitating the programs and services. Finally, develop strategies to hold service providers accountable through quality assurance oversight or utilizing performance-based contracting. Section 5 of the P&I Guide looks further at your data collection process, performance measures, and developing your evaluation plan. This slide highlights the practitioner-evaluator partnership, which has already been mentioned by Deanna. In comparison to a traditional evaluation, action research is a continuous cyclical process as opposed to a linear process. It also more fully engages the practitioner of the program or intervention than a traditional evaluation would. Rather than occurring after the event, the research is happening in real time and providing feedback to you so that adjustments can be made along the way as needed. It's strongly recommended that you engage with your research partner right away to help fine-tune your activities. As noted on the left of the slide, the Innovation Suite Researcher Practitioner Fellows Academy will be held this summer. This is one of your trainings required by BJA, but it's a wonderful opportunity for you to spend time with your research partner as well as the other grantees in your cohort discussing and learning about latest trends in action research. Sustainability is difficult to achieve and becomes even more challenging if neglected until the grant funding is coming to an end. Developing a sustainability plan at the onset is essential to building a strong initiative that can continue after the grant funding concludes. Program outcomes and other measures are instrumental in conveying the impact of the initiative. Collaborating with your evaluation partner about your sustainability strategies will provide the foundation for this effort. Connect sustainability to the evaluation. The action research partner should be able to document outcomes that grantees may use to make the case for continuing their work post-grant period. This was just a brief overview of the P&I Guide and how completion of each activity will help shape your project to include the elements found to be successful. I'm pleased to introduce Dr. Vinyl Baker, grant writer for the Fulton County, Georgia Sheriff's Office, who is a fiscal year 16 Innovations in Reentry Initiative grantee. In her role with the Sheriff's Office, Dr. Baker is overseeing the planning and implementation of their reentry project and joins us to share her experience as a grantee. Dr. Baker?
Can everyone hear me?
Yes.
Hello? Okay. Fulton County is employing evidence-based intervention for participants while in custody and within the community as we serve 300 moderate to high-risk offenders age 18 to 24 who are returning to 3 neighborhoods in the Westside Atlanta Promise Zone area. Fulton County is, okay, I got a little mixed up there. Sorry about that. This section right here talks about the first phase that we did as far as how did we go about getting an evaluator. I recommend that you hire an evaluator as soon as possible with experience as an action researcher that will design and conduct a rigorous evaluation. The evaluator should spend time getting to know your organization and your reentry plan because they are the driving force behind planning and implementation phase of the grant. We are fortunate to have an evaluator familiar with our target population and familiar with transition from jail to community model. The project director would take the lead in working directly with the evaluator as a liaison with the task force. At a minimum, the research partners should assist with finalizing the strategic plan, collecting and analyzing data, finalizing the baseline recidivism rate, fostering eligible program participant flow to ensure program utilization rates, and monitor and evaluating performance, as well as preparing a final report that thoroughly assesses the results of the project. The project director is the person who takes the lead in developing a working reentry task force. The reentry task force should consist of partnerships from all areas of local government, and this is very important, as we found out that you need everyone to support you in your efforts in order to be successful, which include multi-agency task force, strong partnership with community leaders. Relationships matters. It's about gaining trust from local leaders in the community, including internal and external partners. It is helpful if the reentry task force in the beginning of the planning process meet at least once a week. Reentry task force members must know their roles. True collaboration means the project director must find a way for everyone to come to the table. The project director must be open-minded and communicate with all members to solve problems and find a viable solution to the problems, because everybody in your task force might not get along, but you have to bring them back together and remind them of the goal that they all signed up for. And that's a way in which you can bridge any kind of gap that may exist between your partners. The project director and the evaluator should start to develop an outline immediately, which you should already have started with writing your grant proposal. You should describe your goals and objectives. Objectives should be thought of as an outcome that can be expected from the program. During the planning and implementation process, answer all questions on the form. Do not omit answers to questions, as this helps to give you enough detail to demonstrate that your planned activities will work. And you need to demonstrate how an individual will go through your program from point A to point Z. The timeline for release and reentry plan varies from individual situations and depend upon various factors, but the transitional planning needs to start upon entry at the jail. We start our reentry program when a person first enters jail. Here is a model of our project system flow. Think about the connection to the following services before release: housing assistance, employment and education assessment, proper documentation of individuals identified, such as identification cards, Social Security cards, birth or marriage certificates, and education certificates. Individuals exiting the jail with substance abuse and chronic physical and medical conditions will require linkage to medical treatment facilities and ongoing health care in the community. All of these can be the greatest barrier to an individual's successful reintegration into the community. Therefore, all these connections to services should be considered before a person is even thought about being released. All individuals should be equipped with knowledge and resources to attend to their basic needs at the moment of release. For example, Fulton County Sheriff's Office formed a partnership with a community center to assist in this transition. More importantly, the community center is located in the area where most of the individuals from the jail will be returning, and this is important, especially if they do not have transportation. They can go to this community center and actually still receive the services that they were receiving in the jail. Like if they were working on their GED, they're able to go to our at-promise centers and still receive that service free of charge. Thank you.
Yes, thank you, Dr. Baker. Listeners, now is your opportunity to ask questions of any of our panelists. Please enter questions into the Q&A panel box, and we'll get to as many as we can. We do have quite a bit of time left, so we'd love to hear from you. And we'll follow up with any questions that we don't get to by email. Dr. Baker, I was going to ask you to talk, if you wouldn't mind, a little bit about maybe as you look back at your year of starting up your grant and all the activities that you went through, is there anything that you would have changed to make things run more smoothly?
Well, I guess one of the things is that communication is important. And when you're trying to get all these leaders together from the community and local government, you need to start early, because you're going to have leaders from different political parties, you're going to have community people coming from different areas, and you need to form a meeting where everybody can somewhat try to get along. Everyone is going to bring their ideas to the table, but of course you can't use them all, but you need to try to have a compromise, and that's where the project director comes in. The project director may have to meet separate with some of the community leaders to get them to see your vision, because a lot of our community leaders were a little suspicious of us simply because people have made promises before and they haven't been able to keep those promises. So I had to prove to them that underneath Sheriff Jackson and under my leadership that I was going to keep my promise. So I had to meet with a lot of them separate to get them to come to the table. But once I got them at the table with the other local government, it worked out great. The other thing is the RFP process can be, I don't know how it works in other counties, but it can be a long process here in Fulton County because there's so many rules to getting someone to, when you're talking about giving out a $200,000 contract for substance abuse, you got to make sure that everybody is given a fair chance to bid on it. So you need to start working with your purchasing department or your bid department early to make sure that the language is the way it needs to be, because it's going to have to sit out for maybe 3 or 4 weeks. At least that's the way it is here. And then we get the proposals back in and we select the person that we think can actually do the job. But even the selection committee can be it can be political. So I would suggest that you get people on your committee who's knowledgeable in that area. If you're looking for someone to perform substance abuse or employment service, try to get people on your committee in your county or your city that's familiar with employment for a high-risk area. You don't want to get somebody on there that say, oh, we think this person can do it because we know them. They need to be able to demonstrate, because this is a hard population to place in employment and in housing. And we've actually started to apply for different housing grants too, and people who are willing to work with us with this population, because housing and employment is going to be two of your biggest challenges.
As I recall from your planning phase, you started adding people to your task force that were from the neighborhood areas that you targeted to make sure that you had those connections to the community members. Is that correct?
Yes, that is correct. I actually went into the community and found out who the leaders were. And the leaders may not be someone who has a title saying that they're the leader. I mean, you may get a pastor from that particular church. We partner with one of the largest churches in our area because it's his congregation that we're serving. And we got the pastor on board, and he introduced us to some of the deacons and other people that could help us bridge the gap between law enforcement and the community, because right now there's a lot of tension between law enforcement and the community. So we had to go in a different approach. We had to go in, you know, like, we're here to help. We're not here to take anything. We want to help bring this community back up. So we started meeting with the local pastor, who introduced me to some local leaders that I wasn't even aware of. But they are able to help us in other areas. You know, we got a center in one of the largest drug market. Our center is located in one of the largest drug market in the Southeast. But we have not had one incident over there, simply because we partner with the church and we got with some of the other local leaders, and they just say, you know, leave that center alone. They're trying to do good work over there. So you may run across some people that may not look like you, or they may not have a title, but they could be leaders in that community that you need some information from and you need to talk to.
Thank you. I think that's really good advice. I was wondering if you could talk a little bit about your experience working with your TA provider.
My TA provider has been great. I mean, when there has been time that we needed to be corrected on something, they've been willing to step up and let us know you need to look at it this way. And then there's other times when we have explained things to our TA advisor and say, well, this is the reason that we're doing it this way. What do you think? So we always keep the person, well, I keep my TA advisor in the loop, and I suggest that you do the same. Develop that relationship. Communicate with your TA advisor if you're having any problems up front, because they may be able to give you a resource that you didn't even think about. But don't let it just linger out there, and then when the report is due or something is due, you say, well, I couldn't meet my goal, but if you had communicated with your TA advisor ahead of time, you probably would have been able to meet your goal.
That's great. Thank you. Let's see. We had a question. Someone was interested in learning how we might be able to connect with the other grant recipients. That's something that the TA provider is very helpful in making those connections when we're seeing commonalities between grants. We've recently connected several grantees that are all focused on transitional aged youth. And they were able to have a conversation about what different approaches they're trying. So that's something, as you're saying, Dr. Baker, the more you communicate with your TA provider, the more those sorts of things can happen. And are there any more questions out there? Does anyone else want to ask something of our panelists? I think we will have, like I said, we will have this webinar posted hopefully early next week, and we will be in touch with you very soon with your initial phone calls with your TA provider. And unless there's any other questions, I'd like to give a special thanks to all of our participants today, especially Deanna Hoskins of BJA, Dr. Baker of the Fulton County Sheriff's Office, Keisha Thornton at the CSG Justice Center for her technical assistance, and we also had on the line, we had Erica Nelson and Bonnie Sultan, our other TA providers. I would just like to remind you to take time to sign up for the NRRC mailing list for any of these key resources, and this concludes the webinar. Thank you.
Thank you.